Hello, Mr. Torres. My name is Nikita Torres, and I'm a speech-language pathologist who will be working with you today. Today we were going to do the Oral-Mech exam, where I'm going to look at your oral structures and see how they work and function. This will involve me lightly touching and looking inside and outside of your mouth. Do I have your permission or consent to do this? Yes?
Yes.
Do you have any questions for me before we begin?
No.
Okay. Feel free to stop me anytime if you have any questions. So before we begin, I'm going to sanitize my hands to make sure they're clean before putting my gloves on. And on the table are all the tools that we will have during the exam. We have the mirror, the tongue blade, and flashlight, and on the side is our timer. So to begin, I'm gonna look at your face. Just look at me like this. Good. Symmetrical, no movements, and you are breathing through your nose. Next up is the jaw. So what we have to do is, can you please open and close your jaw slowly like this? Good. Nice movement, symmetrical. Next, I'm going to place my fingers on the sides of your face, and we're going to do the same thing. We're going to open and close our jaw slowly, like this. Go ahead. Good. Didn't hear any sounds. Next up, we're going to look at your teeth. Can you please smile for me? Like this, good. And can you please open your mouth like this? Good. Everything looks good. Good hygiene. Now we're going to look at your lips. Can you please pucker your lips like this? Good. Now we're going to test the strength of your lips with the tongue blade. I'm going to put the tongue blade on your lips, and I want you to push it away like this. Okay? Pucker it. Yes. Good. Good. Strong lips. Now I'm going to ask you to smile again like this. Good. Next up, we have to puff our cheeks with air and hold the air in like this. I'm going to lightly tap to make sure no air comes out. And I'm going to put a mirror under your nose to make sure no air is coming out of your nose. Perfect. Now we're moving on to the tongue. Can you please just open your mouth for me like this? Good. Pink color. Normal size. Now we're going to raise our tongue to the top of our mouth like this. Good. I'm just looking underneath your tongue. Now we're going to stick out our tongue like this and bring it back in like that. Good. I'm going to ask you to stick your tongue out again, and I'm going to test the strength. I'm going to put this to your tongue, and I need you to push it away from you. Good. Strong tongue. Next up, we're going to see how your tongue moves from side to side. So now, first, we're going to go to the right, like this. And I'm going to test the strength again. I'm going to put this to the corner of your mouth, and I want you to push it away, okay? And push it to that side. Good. Same thing, we're going to go to the other side, to the left, like this. Good. I'm going to put this to the corner of your mouth, and I want you to push it away from you. Good. Next up, we're going to move our tongue up to the roof like this, and then down to the floor, and then up and down like this. Good movement. Now we're going to go side to side, from left to right, like this. Good motion. So next up, we're going to the back of your throat. I'm going to check the color and see what you have. Good. Pink. Good. Normal height, normal width, no growths. Okay. So this part is, we're going to look at your gag reflex. So I'm going to slowly bring this tongue blade to the back of your throat just to see if you have a slight reaction. Okay, can you please open your mouth like this? Okay. Okay. Good, you have a normal gag reflex. Up next, we're going to say ah 3 times like this. Ah, ah, ah. And I'm going to look inside of your mouth with my flashlight.
Ah, ah, ah.
Good movement. Would you like some water?
No.
No. Good. So we're moving on to the next portion of the exam. We're going to look at how fast you could say your speech sounds. So the first sound we're going to work with is pa. Can you say pa?
Pa.
We're going, I'm going to ask you to say it as many times as you can. And I will tell you when to start and stop. So it'll be like this.
Okay.
Pa, 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 pa.
Pa, pa, pa.
Ready?
All
3, 2, 1.
Pa, 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 pa.
Good. Next up, we're going to do the same thing with ta. I'm going to ask you to say ta as many times as you can, like this. Ta, 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 ta. And I'll tell you when to start and stop. You want to practice? Or you're good?
Good.
Okay. Ready? 3, 2, 1, go. Okay, stop. Good job. Our last sound is ka.
Ka.
So same thing, I'm gonna ask you to say it as many times as you can, like this. Ka, 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 ka. And I'll tell you when to start and stop.
Okay.
Ready? 3, 2, 1, go. Stop. Okay, the last thing is we're gonna bring all those sounds together and say patika, 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 patika. As many times as we can. And I'll tell you when to start and stop.
It's good.
Okay, ready? 3, 2, 1, go.
Patika, 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 patika.
Okay. You okay?
Patika.
Okay, so now we're done with the Oral-Mech exam. Do you have any questions about anything that happened today?
No.
Well, thank you for participating. I'll see you next time.
My pleasure.